Well, welcome to another episode of our Mental Health Moments. My name is Linda Golick. I'm the Health and Wellbeing Consultant at Amplify Health, and I am again joined by two amazing behavioral health therapists, Michaela Vandenboom and Hannah Bauer. Hello, ladies.
Hello.
Hello.
How are we doing?
Well, yeah.
Well,
Good, good. We are watching summer fly by as when we are doing this recording. So excited to get this out here for our audience. So this next lifesaver wellbeing topic is the midlife pause, supporting women in the workplace. There are millions of women that are in the stages of perimenopause, menopause, and postmenopause that are in our workforce, and they are also doing all the things that women do. They are raising families, they are supporting aging parents, they are providing services in our community, they're working, and we're learning statistically that women are also leaving the workforce in these midlife transitions, and they're doing that for a number of reasons, because their symptoms are causing them to feel whatever they may be feeling, and making things uncomfortable and making things more challenging. And we all know that women certainly provide a valuable perspective in all areas. So from a mental health perspective, we're going to talk about what is going on at this stage of life. And how we can support particularly mental health and well-being in women at this time in life. So this is going to be a fantastic conversation. I'm super excited about it. So ladies, let's start with what is going on? What is going on with women physically and psychologically at this stage of life that may be affecting their mood and their emotional regulation and really their overall health and well-being? So who wants to start on that one?
Go ahead, Michaela.
well, I mean, it boils down to, honestly, the big hormonal shifts that we experience in life. And I think the biggest thing is it's not talked about enough, right? We have women that jump into the workforce or wherever they are in that stage of life. You come directly into it in your 20s, into your 30s. Some have children, some do not. You kind of just push through, navigate through that. And by the time you finally feel like, hey, maybe I've got my feet on the ground and I'm settled into this, I'm doing all the things I should be doing, something doesn't feel right. I don't feel right. I'm tired, I have low energy, I have brain fog, I'm anxious, and maybe there are some stressors outside that are significant that are going on that are impacting us, but a lot of the times they come in, they're just like, I'm doing all the things I should be doing. Why do I still feel this way, and what's going on? And that's where they jump into therapy a lot of the times to try to figure out, am I having some struggles with anxiety or depression, or do I have maybe some underlying diagnoses that I have never addressed? And sometimes that's the case, and sometimes they go hand in hand, and sometimes it's really a lot of hormonal fluctuations and physical and psychological changes in our bodies that we're just not educated on or aware of.
Right. Because I think for a lot of people, like that conversation doesn't start until a problem is recognized or felt. So, women are working, like you said, from their 20s on, but like it's never a problem until it becomes a problem. And that's way later. There's so many opportunities for conversation, education, intervention, or just having that discussion of like, this is how this is going to feel. And then in your 30s, you might notice this, and then there might be a shift and you can anticipate X, Y, or Z. And if you're, working full time, you're going to have to be mindful of these things and maybe talk to your employer about this. None of that happens. And then all of a sudden, everything is overwhelming and it's a problem. And we're looking for like, how do I fix this? When, it's been building for years and there is no quick, easy fix all the time.
Yeah, I was thinking about this, and I just feel like in terms of health education, we learn really well about the reproductive years and about what's going on with our bodies and pregnancy and fertility and some of those types of things. And then we learn that, oh, one day you're in menopause when that all ends. And we don't talk about the middle We
Mhm.
don't talk about the middle, and there's this big chunk in the
Mhm.
middle when your body is really the egg supply is depleting, and that is causing all of these hormone shifts, and then hormone shifts and loss of all these hormones is really what causes all of these symptoms in
Mhm.
women's bodies. We don't talk about that, and I'm so glad that we live at a time where I'm seeing more about this. I'm hearing more podcasts about it. I'm seeing more articles written about it, and of course, we here have decided that it's an important topic, and we really want to talk about it. So how can a woman then kind of tell the difference? Like, stress is real and we're all managing stress and life is happening and oh my gosh, all these things I'm trying to manage. How do you know if that's just regular stress or if it's something kind of over the edge of I do need some support. I do maybe need to seek therapy. I do need to talk to a medical provider. Like, how do we know?
I mean, I would take the approach with kind of with anything. Like if it's disrupting your life, talk about it. Go see a provider. Have them tell you that, okay, yep, this is what I'm seeing and this is what I would recommend that you do. You don't have to make all of those decisions just on your own because again, we've just mentioned there's not a lot of education out there. There's not a lot of conversation. So for someone to rely on themselves to decide what's, typical versus what's not, I think that's unfair. So I think, yeah, the second that you notice something, and if you're noticing it for a while, talk to your doctor, right? There's nothing wrong with that. Or maybe you set up a therapy appointment because you're like, something just feels different. That's
Mhm.
okay. Get an outside perspective, get some, encouragement and validation, and that can kind of give you some direction.
I think in addition to that, if someone's already been in therapy and we feel like, hey, we've tried all
Mm-hmm.
these suggestions and we're still coming up with no solution, maybe
Mm-hmm.
that's time where we think about something else. I honestly,
Yeah.
any woman that I have that is of the age of having a menstrual cycle and beyond, I have them track where they're at mood wise with their cycles and their
Yes.
Oh,
productivity.
yeah.
Because a
Yeah.
lot of them don't realize that it goes hand in hand.
Yes.
Like mental health and your hormones are a continuum and they
Yes.
fluctuate. And if we can pinpoint, you know what, the week before I get my menses, I am absolutely falling off the planet and I need some extra support, then we do that
Yes.
and we navigate
Yes.
that and we do the best that we can with therapeutic support or following up with our medical providers. And we just see what is going to work best for that stage of life.
A lot of pattern recognition and then, yeah, just creating a plan.
I love that suggestion because I think how many women have never heard that? Like do some
Mhm.
tracking and
Mm-hmm.
then track your emotions, your
Mhm.
moods
Mm-hmm.
to see what is happening. And we can do that for the duration of our lives. Like do some tracking of emotions and moods so you can start to see what's really going on. Because there's something really powerful about putting something down in black and white, isn't it?
Mhm.
Just to see it like on a piece of paper in a notebook or
Mm-hmm.
something like, oh, okay, now I'm starting to see what's going on here.
Mhm.
Mm-hmm.
Love that. Love that. Another thing that kind of happens, and the person I had on my podcast, we talked about this a touch, is the idea that, one of the things that happens to women because they start to, kind of not feel like themselves, it starts to take a toll on them. It takes a toll on their confidence level, and they start to feel like, oh, I'm not who I used to be, and maybe my purpose is a little bit different. What have you all kind of recognized with that, and what have you seen in terms of that and your maybe your patients over the years?
I've seen several women that kind of have a little bit of an identity crisis, honestly. Like,
Mm-hmm.
Mhm.
I'm not as fulfilled in what I'm doing, and I don't feel like I'm doing as well in what I was doing previously. What can I be doing differently? Or maybe I do need to shift a career or take a step back from focusing on my full-time hours and step into maybe focusing on myself a little bit more. I know a lot of the times it impacts like not just your own relationship, your self-esteem with yourself, but romantic relationships and family dynamics too. I've seen all of these hormone shifts really impact those dynamics in positive and not so positive ways as well. So then working through that is really important. We don't view the preteen version of women the same that we do the teenage version as we do the women in the 20s. So why are we stopping that? We need to honor that we're not going to be the same person as an adult throughout the rest of our lives. And that's okay if we shift who we are or our purpose or our interests or what we feel is best for us out there in all aspects.
Mhm.
Yeah, I mean, even, for a session starting out, like it's oftentimes, okay, like what are the things that you like? What are the things that you do to relax? What are the things that make you happy? And a lot of the time they're not able to answer, because number one, they're not being asked that question by really anyone else. They don't feel like they have enough time to even like sit and reflect and be like, what do I like? And then when they do in a session, it's like, oh, I haven't taken time for myself in so long. Like, who am I? What do I like? Like, who do I want to be? All those questions that, when you're younger, people are always asking, like, what do you want to be when you grow up? What's important to you? What do you do for fun? They slowly stop asking you those questions as you get older. And then it stops feeling like it's important. So you throw yourself into your job and like your title becomes part of who you are. Your role in your family, your role in the relationship becomes part of who you are. And then when you take a step back, when things aren't going how you want them to go and you're not feeling how you expect to feel, it's like, well, who am I in this? I've completely lost myself.
Yeah.
So just, yeah, bringing that back up and like almost like giving yourself permission to then start to explore those things, make
Mhm.
some mistakes, try a hobby that maybe you hate, just figure out and have that curiosity of like, well, who am I? Who do I get to be at this phase of life? Because that is still important.
Yeah. Just kind of that continued exploration, right? Like we're always evolving, we're always changing. Some of it is the aging, some of it is just life changes us over time. So to continue to encourage people to just be in touch with that and that you can change and be different. That doesn't mean you're a worse version of yourself because you're older and there's different things going on with you. Actually, if anything, it can be an improved version, as you learn more and do more and evolve. And gosh, I just think it's so important for women to give themselves some grace. We manage a lot of different things, and our bodies go from being able to produce babies to into the phase of life where that's no longer possible, and all while managing careers and families and all the things that life brings us. So just being gentle with yourself, and really that theme of advocacy of when you're not feeling right, you're really the only one that really can know that. And so you have to be the voice, right? To say, I don't feel right. Something's off here.
Yeah. And I try to remind people like you get to be human, right? It's unfair for anyone to expect you to be anything but. And as a human being, you're going to have a ton of experiences. Some of them will be wonderful, some of them might be difficult, but you get to be human. You get to recognize what works well for you. You get to advocate for yourself. You get to tell people, hey, this is what I need, and this is what I need that to look like. You get to get burnt out and need to take a break or a step back. You get to be human. You don't have to do and be everything to everyone.
And you don't have to have all the answers and know it all either.
No, yeah.
Yeah,
Most of the time you won't.
exactly.
Mm-hmm. And we're also different too. I mean, I think that's something to remember too, in that what might be working for your friend or your sister
Mhm.
or your cousin may not work for you. And that doesn't mean that there's something wrong with you. That means that you're a
Right.
different human being.
Mhm.
And it's okay. And that was something my the Prescription for Life podcast guest, Erin, really talked about that. Like just being willing to try different things and reach out, talk to different people, learn from other people, but that doesn't mean that will be the right thing
Right.
to make you feel better.
Mhm.
Exactly. I think education is key too, right? Like we have never been at this stage in our lives before, so why are we trying to pretend that we know everything? We
Yes.
need to
Mhm.
seek the education and learn different methods, learn different things that work because
Right.
we were taught that, we were guided that all through our lives, and then just thrown to the world and saying, "Hey, figure it out." We don't
Yes.
know it all. We never will. So we
Right.
need to we
Right.
could advocate for ourselves, educate ourselves, learn about different methods that may be helpful, different approaches.
Yeah,
Yeah. It's a lot of
absolutely.
trial and error, but that doesn't mean you're doing anything wrong.
Mhm, mhm. So, what would you then say? What would be one piece of advice that you would give to women about really protecting, their well-being, their mental well-being, during these later life stages? What would you say would be your big nuggets of advice?
Um, I mean, honestly, similar to what I've already said, like, you have permission to be human. At the end of the day, like, regardless of what title you're holding, how well you're doing in certain areas, what relationships you have, like, you are a human being, you deserve care, you deserve to be listened to, you deserve to be feeling good, feeling like yourself. So take that, like, as a human being, you have value. If you need something, go get it.
Yeah.
I mean, to follow up along with that, Linda, you already said it. I often use the phrase, give yourself some grace, give yourself some credit. You don't
Yeah.
have to do it all. You don't have to know it
Mhm.
all. It's okay to take a step back and put yourself on the front burner a
Mhm.
little bit.
Yes.
Yeah, absolutely. Absolutely. Well, ladies, as always, such a great time chatting with you and really hearing your expertise, as the folks that are doing the patient care and are really seeing all the different scenarios out there with what people are experiencing. So I just always so value your perspectives and your professional opinions and your heart for giving and giving to our patients. So thank you. To our viewers, thanks for joining us today. Please continue to join us on this campaign. We have a lot of content coming up that will be available to you to help you continue to learn and educate yourself about perimenopause, menopause, postmenopause, all the things affecting women in those later life transitions. So stay tuned for more content on that. But until then, be well, and we'll see you all next time.